Welcome to Progressive Short Takes. This is Joe Firestone. I'm your host, and tonight I want to talk about whether Medicare for All can beat the COVID-19 virus by itself. Very recently in Counterpunch, there was an article called Only Medicare for All Can Beat COVID. It was written on August the 21st by Eve Ottenberg. And she contends that only Medicare for All can beat COVID. Her article is a well-written one, but the main evidence that she presents for the idea that only Medicare for All can beat COVID is the experience of Canada. And she points out that Canada's performance with respect to the COVID-19 is much better than the United States. And she says, now would be an excellent time to hear full-throated pronouncements from politicians like Bernie Sanders, who is so prescient about our ghastly healthcare system. To hear him talk about the success of, say, Canadian healthcare. Canada has a single-payer system. It has worked. Our neighbor to the north is not drowning in a sea of COVID corpses. It's time for a little humility here in the U.S. Our health system is broken. It doesn't work. We should look elsewhere in the world for a new model, and we should do it fast. Now, I do want to be very clear about this. I do think that it's time for humility here in the United States. I do think our healthcare system is broken. I do think it doesn't work. And I do think we should look elsewhere in the world for a new model, and we should do it fast. I also think that we were really stupid not to introduce a single payer as soon as the pandemic arrived. We were stupid to do it even before, not to do it even before that. But we're especially stupid that we didn't jump right into it when the pandemic arrived, because it was obvious that it would have helped a great deal in fighting the pandemic. And I think it would have greatly improved our performance, and we would not have the sea of COVID corpses that we have now. But if you look at our performance right now and compare it to other countries, we not only see that we have done very poorly, except for a couple of small countries. We are 8th in the world in deaths per million from COVID. As of today, we were running at 547 deaths per million. Our total deaths from COVID, 181,114, according to the Worldometer site. And that's bad. Okay, that's bad. But if we look at Canada, we see Canada is 23rd in the world. If we exclude some small nations, they're still 23rd in the world, and their deaths per million is at 240, which is not really very good performance. Their total deaths on 9,000 83, and if they had the same population, okay, that we have, then they'd be running somewhere around 84,000 or 85,000 deaths, okay, at this point. Still, in my view, a sea of corpses. So this alone shows that just a switch to Medicare for all would not have solved the problem, okay, of COVID. It's a question of what you take as the standard for declaring that you're solving the problem, or you're managing the problem adequately, or you're containing the problem adequately. Let's look at some other English-speaking countries. Of course, if you look at the UK, of course, they have not performed well at all. Not even compared to the United States. They're at 610 deaths per million. Of course, we're getting many more deaths per million as we go forward in time. We're very likely to overtake them, perhaps in as few as 2 or 3 weeks, so that we will be the worst performing English speaking nation. But if we don't count India, which you could argue is also an English speaking nation, because there may be more people in India who speak English than either Hindi, okay, or Urdu, or Tamil, or some of the other. In other words, you can argue English is the lingua franca, okay, of India, but I'm going to go out on a limb here, since it's culturally very different as compared to the U.S. I'm not going to consider it as that close a cultural cousin to the U.S. But if we now go away from the UK and the US and also Canada, we see that it's possible for English speaking countries to perform far better than these three specifically. Okay, if we take a look at the performance we find in Australia, we see that Australia is currently running at 21 deaths per million. And if they were our size, and they've had a total of 525 deaths, and if they were our size, they might have had something like only 1,000 deaths. We have 181,000 deaths, okay, at this point. So they are far exceeding our performance with respect to managing COVID. Okay. So scaling up their population up to our population, that's what we see. If we look even further and we go to New Zealand, there, of course, we're looking at 4 deaths per million. Total deaths of 22. Of course, we have to scale up at New Zealand something like, 10 times, 60 times, roughly 60 times our own size, okay, maybe a little more than 60 times. So we're looking at, we would have had something like 150 deaths here in the United States if our performance was comparable to New Zealand's performance. So the examples of Australia and New Zealand are instructive in terms of how well it's possible for English-speaking countries to do in managing COVID. Now, we can go even further, and we can look at a country which, even though it is not as culturally similar to the United States as the English-speaking countries, it is still similar to the United States in one respect. Specifically, the Medicare for All system they have in Taiwan was copied from our Medicare system. It was constructed, it was designed as our Medicare system scaled up to cover everybody with, okay, I've forgotten now whether there are any copays, okay, or any deductibles there, okay, at all. I believe if there are, they are very, very low. But Taiwan now covers nearly 100%, nearly 100%, okay, the population. They have an appreciable population at roughly 24 million people, 23.8 million people, and their deaths per million is 0.3. Their total deaths have been only 7. If we scale up their deaths to the size of the United States, we're looking at something less than 100 deaths here in the United States. If we had managed a pandemic as well as that, then literally, well, we wouldn't be worried about it here. We would have handled it. We would have managed it. We would have triumphed over it completely. So, this gives some strength to the argument that Medicare for All by itself could have beaten COVID, because certainly 0.3 deaths per million is beating COVID. If anything is beating COVID, okay, it's that. But we probably would also have concluded that Australia and New Zealand as well were beating COVID too. I don't think it's correct to argue that Canada has been beating COVID. When we scale up Canada to the size of ourselves, and we note that they would have had about 85,000 fatalities, okay, in Canada, if they were the same size, okay, as us, in my view, that's still a sea, okay, of corpses. So my contention is that simply having a Medicare for All system is not sufficient to actually beat the disease. You also need testing, contact tracing, quarantining, isolation where necessary. You need very tough provisions, exacting provisions, and control over incoming travelers to beat it. Certainly, a Medicare for All system helps, but the evidence from around the world does not suggest that a Medicare for All system alone is enough to beat it. And I haven't even pointed out yet that in the UK, they have something better than a Medicare for All system. They have a National Health Service there. and they are among the highest in the world with respect to deaths per million in COVID. So while I have a great deal of sympathy for the argument, Kay Vattenberg, okay, and others who say if we only had a Medicare for all system, we would have beaten this, I don't think that's quite true. I think you need the kinds of tactics being used and the kinds of strategy being used in Taiwan, in Australia, and in New Zealand to be successful in beating COVID. And you need a Medicare for all system. You need all of those things. So that's this progressive short take. And I will leave you now, and I'll be back shortly with another progressive short take. But before I go, I want to remind you again of my Patreon account. I am at patreon.com/Joe Firestone. Well, thank you very much for coming and for listening, and I'll see you soon with another progressive short take.